Gagnon, CEO of One Up Health, here with the One Up Health webinar series. Today, we're going to take on the topic of health data interoperability regulatory roundup. I have my two colleagues with me, Eden and Don, who will introduce themselves. And we're going to start off with Eden. And Eden, why don't you give us sort of a bit of an update on where we are with the major rules that are, across the industry right now?
Perfect. Thank you, Joe. So hi, as we mentioned, I'm Eden Avraham-Katz. I'm the General Counsel and Privacy Officer here at One Up Health. For the purposes of this regulatory roundup, we're going to talk about three core regulations, primarily ONC, or the Office of the National Coordinator for Health Information Technology, and their Cures Act, which was recently updated in April of 2023. We're going to talk about CMS, or the Centers for Medicare and Medicaid Services, and their recent update to their patient access and interoperability regulation in December of 2022. And lastly, a little bit older, the Department of Health and Human Services, or HHS, released a proposed update to HIPAA, the regulations that essentially govern patient privacy and security. So those are the three regulations we're really going to talk about today. And as we kind of dive into these a little bit more, we'll give you more context in terms of where we are and where we stand.
Thanks, Ed, and I appreciate that. That's a good overview. Don, you had the privilege of working actually in the federal government for a while. At your time at ONC, you had to deal with all of this policy making. Can you talk a little bit about how you think the rule has evolved, where this new rule is going, and, what do you think about interoperability at this moment in time?
Yeah, I think, I apologize, a little bit of hoarseness. But I think there is an awareness that we haven't made healthcare digital. We've just fundamentally haven't made it digital the way we have the rest of our lives. And so there's just the screaming question of why not and how to do it. That's one big elephant in the room, if you will. I think the other is, obviously, we haven't really figured out how to get value out of our healthcare dollar as a country, just haven't. And so when you look at all of these rules, proposed rules, it really is this search for value, search for empowerment. And then if you think back from that, then you can look at those rules, figure out what's there, what might come in the future, how to think about them, because those, I think, are the real touchstones.
Don, maybe a little bit of follow-up on that. There's been, it comes somewhat irregularly, but there's this new push around this idea of TEFCA. Maybe you could define for people what TEFCA is and what the implications are relative to this idea that, are we really moving forward in a digital economy in healthcare, or are we sort of finding a little bit of struggle to get there?
Yeah. So for folks, the 21st Century Cures Act back in 2016, so signed by President Obama, almost unanimous in Congress, implemented by President Trump, really had three provisions in IT land: APIs, application programming interfaces, without special effort, so no toll taking, modern data. A. B. No information blocking. So in the spirit of extending HIPAA, you have a digital right to your data, not just go to a portal and get your data, or go to medical records and get a photocopy of your data. The third part was a concept not defined called TEFCA, Trust Exchange Framework Common Agreement. And this was, I think, a thought, we'll teach the world to sing. Somehow there will magically be a network. I think the challenge in the way that DC works is we now have a proposal there, and that proposal really sort of harkens back to the 1990s protocols, document-only view. Back, for those of you who are old enough, when everything on the internet was a whole page. So you couldn't compute, you couldn't shop, you couldn't book your airline ticket, you couldn't see what was in your bank account. It was all this very page lookup view. And some of it maybe through lobbying, some of it through not maybe understanding the opportunity of the modern internet, we now have in play, and increasingly in play, this very old school non-computable view of data. So forget the app economy, forget your smartphone. This is a pre-smartphone view of the world. And I think, Joe, the question is this really where we want to go in 2023?
I'm sort of struck by the idea, we both know that years and years ago, I worked at Presbyterian Medical Center in New York City, and we built a chart tracking system so we could keep track of those darn charts. And now we are, then we went to microfiche, and that was a heck of an advantage. And then we started building EHRs, but they sort of represented still a lot of what the medical record as a piece of paper looked like. And it sounds like we're struggling to move this to the next phase, which is that everything in there is a data element, and that data element as a computable item would help get better insight across the patient population for an individual. Really, we want to provide better value, better care at a lower cost. But if we can't compute on that, how does that happen? And do you think that, the reason why TEFCA is getting some momentum is we just feel comfortable representing this data as a document, even if we haven't contemplated the practical implication of that?
Yeah, it's sort of the disconnect between healthcare and the rest of the economy is getting larger, sadly, and not smaller. In our rest of our lives, we want a sports score. We want, a current weather report. We want whether our flight was delayed, right? We want to compute on individual data elements. To go back to essentially digitizing the facts with document-only architecture, I think is simply wrong. It raises a question, why are we doing this? And of course, there is, frankly, a suspicion that there are a number of folks who were around in the Cures Act rulemaking who actually didn't want to share data, right? Who really didn't want to have compute, who liked the bubble, liked their warm, happy nest of their business model. And so I think some of those have sort of, But
that is the innovators. That's the innovator's dilemma, crossing the chasm. When we go back in history, the first electric car really practically was built in 1898, but General Motors built one in 99. They were 52% market share leader. But the reason they never really went to the electric car is because they had the combustion engine car and they didn't want to cannibalize their business. It's really sort of practical in some sense, not even nefarious. It's just, I have a business. I don't know that I can replace my business. So I think that, as One Up Health, our sort of mission here is to take the industry to the next level with digital computing, to allow for the sharing of this data and the computing of the data for the benefit of all. This isn't for any individual company. And so that is indeed probably not that hard to understand. The question, and we'll continue this dialogue, is what do we do about it? Because we have to do something. We can't just sort of allow that to be.
If we want modern value to get some bang for our huge buck in healthcare, if we want apps to help us with our blood pressure, our weight, any medical problem, we need to compute on individual data fields. So the longer we take to get there, the more roadblocks we inadvertently throw in our way, the bigger the challenge. And that fundamentally is existential is a huge word. But that is the challenge of, do we go in the TEFCA direction, or do we go in what are called RESTful or FHIR APIs that are in the spirit of the entirety of what you have on the rest of your smartphone? That's
what we'd like to live with. Eden, why don't we talk a little bit about one of the elements that may move us in a good direction here, right? So the ONC has this new baseline of this USCDI, United States Care Data for Interoperability format. Want to tell us a little bit about that and how these standards help with interoperability?
Yeah, so definitely. What's really exciting about this update is what we're seeing is a transition starting in 2025, so we got some time, but a transition from version 1 to version 3. So this is actually an expansion of the existing data classes that were required typically through either the ONC Health IT Certified program, or actually CMS's interoperability program, right? So any reference to USCDI will essentially be updated now. And what's exciting about this is that we're seeing an expansion that kind of can be bucketed into two core categories here. So one, you're seeing data elements that are more supportive for care coordination across the care continuum and organizations across the care continuum, from providers to payers to other care coordination organizations. So with these additional data elements will really support more data going to more relevant people, which is great. I think the secondary piece of this is you're seeing an expansion of data elements in response to public initiatives or other related activities. So for example, we see a huge uptick in social determinants of health data. And I think what's great about this is that you're starting to see an understanding that healthcare isn't what happens at the hospital. Healthcare is what happens every single day as you live your life and the circumstances around you. And so I think with these data elements being expanded, you're getting a more holistic view of that individual's surroundings, circumstances, things that impact their health that might not be direct treatment. And I think that's going to be really impactful to better understand any individual's plight as they go through their care journey. So I think this is a really impactful change to interoperability, and I think this could have a really strong positive effect in terms of expanding data.
And how does that affect solution providers and other sort of entities within this care continuum?
Yeah, so I think realistically, there's the technical implications, of course, right? So we need to make sure that we can support not only the sending, but the receipt of those data elements. I think today, the way we capture social determinants of health data is slightly infantile in its process. So we need to get better visibility and traction in terms of how we do that. I also think realistically for organizations, they're going to need to figure out how to actually embed this data as part of their workflows and how they think about that data and how they use that data to actually better care for those individuals. So I think there's going to be some procedural changes in there that will need to be thought through. The technical implications are obviously always there that we have to think about. But I do think realistically, if implemented correctly, this could really impact how people provide care.
But it seemed like till 2025 is enough time for everyone to sort of catch up and get on board.
Oh, I hope so, right? I mean, realistically, that deadline is there for a reason. I think one of the things that's interesting about the USCDI standard is they typically do updates annually. So you typically see an update to that standard every July. So we've already seen an update in the form of version 2 that just wasn't enforced by regulation. I think the general understanding is obviously these exist for a reason and these are aspirational, even though they're not enforced. So I think realistically watching those trends and seeing how those data elements expand should give you good visibility to what's to come from a regulatory perspective. So I'm hoping that, with these social determinants of health data elements, especially, we've been thoughtful about them for a couple of years now. This isn't new, right? This is something we've been thinking about how we integrate. And I think we'll get better at it as time progresses as well. And technology catches up. So I think realistically, 2025 feels like a reasonable period of time. That's not to say it will be an easy lift, but I think it should hopefully, we should be able to do that, especially if you're leveraging technological solutions to help you do that.
Well, I think we're going to come back to you on this one over the upcoming webinars, because it sounds like something really worth paying attention to. Hey, Don, one of the things that, we talk about in the industry has been pondering and sort of probably getting a little bit frustrated with is two words, big words, value and quality. We would love to have high quality healthcare. We would love to get value for healthcare. We sort of embrace them without any sort of understanding of what we meant by them. And now you have Medicare Advantage, this sort of like behemoth of size and scale and the amount of money being spent, $380 billion, without really a sense of quality or value. Is there something going to happen to help us better understand that so we feel like we're getting something for all those dollars and ultimately for the patient?
Yeah. We've been on this, I would say probably 25 years, depending on how you count, journey for value, right? And of course, it's because we have a third-party payer system. So unlike you or I, when we shop, do we want to buy something? Is it worth it, right? In third-party payment, you have to come up with a surround somehow, some type of process or architecture. it really is a data issue. So over the last 25 years, we've had little individual data fields. Okay, well, this provider is better at that, this, and it's been sort of a threadbare soup to have that. And of course, the missing part of it is we don't know what the price is. So even if you say, well, you have a better, value on this score than somebody else, if you don't know what the price is, like how much did it cost? What's the benefit? What's the true benefit? What we're seeing in this world of big data is, as you point out, really two things. There's increasing pressure. For those of you who follow the DC news, in the last half year, there's been news item after news item, many of them from MedPAC, which is a congressional group that supervises healthcare spend on our behalf, saying we cannot measure what's going on in Medicare Advantage. That's damning, obviously, when you think about the spend. But the other more optimistic thing here is, with all the data science, if we have computable data fields, so if we don't get trapped in TEFCA, but use the FHIR APIs that are in the current rules of CMS and ONC, we're going to have way more data to compute value. You're seeing that with NCQA, who are in public records, so NCQA does the scoring of Medicare Advantage performance, so HEDIS measures, if you will. And they have publicly stated they're moving to a FHIR data world. So rather than having somebody individually, right, and that sort of show me your document, fax me the record kind of old school way, they're saying, put that data in FHIR, send it to me electronically, and let's automatically compute the value. So I think we're at the cusp of a different way of looking at healthcare, and ultimately, probably for both fee-for-service and Medicare Advantage, paying.
Yeah. It's so interesting. We get sort of lost in a lot of the analogies of what's happened in the rest of our lives, but they're indicative, and they should build confidence of what can change. Manufacturing quality has improved immensely because of data, right? Just-in-time manufacturing, the delivery of products to one's house and tracking it along the way. Everything from how we invest and share, even a Venmo transaction requires some of the same kind of activities that we're talking about underlying this. And at this kind of spend, we could actually really both, it's not even about saving money, but maybe providing better care, with what Eden was just talking about. So, this is sort of as foundational as any sort of infrastructure change could have ever been.
The entire economy, Amazon, Google, Facebook, every app on your smartphone is working with RESTful APIs. And I think it's a real challenge, frankly, with TEFCA, that we're moving 25 years back there. Now, they're trying to address it so that, they have some fixes. But fundamentally, the problem has been solved everywhere else. So rather than patching up something cracked, why don't we just use a new thing that works?
Yeah.
It's not that complicated, even though it has healthcare in front of it.
We won't go into too detail, but if anyone remembers the Network movie, when someone put their head out the window and said, sort of, I'm as mad as hell and I'm not going to take it anymore, seems to be sort of the order of the day. And really, because this is our health and it matters to us. And actually, the people who work in the system are good people. You're a doctor, nurses and doctors are not the issue, right? This is a process, infrastructure, administrative problem that we should be able to solve. Maybe we'll sort of wrap up with a couple of things in terms of what do we think is happening next. There is lots more that we could talk about today. But Eden, why don't you give us a little bit of your feeling, what's going to happen over the next few months and into the rest of 23?
Yeah, I before we jump kind of into what's on the pipe, I do think what's really interesting to know about all these interoperability regs, there's some variants, right? We talked about the different data formats in terms of how data is exchanged. We're aware of those. What I do want to talk about is the commonality, because I actually think that's where we see a lot of unity. And that's what I think we need to drive towards, right, in this space. So what I love here is exactly what you were talking about, this lack of access to data. That's happening on, obviously, from an auditing perspective in terms of visibility into programs. That's been happening for the individual for years. And all of these interoperability regs have the same core assumption that they're operating under and are essentially built around, which is that if you can empower individuals by giving them access to their own data and letting them make their own informed healthcare decisions, that's how you make change.
Yeah.
And I think about when we talk about these value-based care, systems and processes for like, who's valuing, who's getting the value of that? So I think this movement towards really focusing on the individual and empowering the individual, and by extension of the individual, their care team, to actually access their data and use that and make informed decisions is super powerful. And I don't want to leave a session on regulatory roundup without at least touching on that topic. So I think that's a really impactful unifying point. And I think one we need to remember as we think about interoperability holistically and what we're trying to solve for. Obviously at this point, we do see a lot of common goals, not common direction in terms of how we reach those goals. And I think that's obviously somewhere where we're going to need to bridge that gap a little bit. But I do think, especially with these proposed changes from HHS as it pertains to HIPAA, I do think that's a really strong step forward in starting to create the balance between patient privacy and interoperability. We're seeing that dynamic day in and day out, in terms of how do you promote both at the same time. And I think these changes will help us do that. I think that's one large barrier. I think the next is the one we've been alluding to this entire time, which is how do you do that in a way that's consistent so that data is actually computable. But I want to focus on the positive here in terms of just outlining that this movement towards empowering individuals is actually very empowering to hear. So I think it's exciting. And I think that's a good movement for the future as well. So I'm hoping that continues to be true.
We'll talk some more about that in the coming episodes. Don, what do you think?
So I've been doing this stuff for more decades than I'd like to remember, or maybe can remember. But I think, we've struggled to computerize healthcare. And I think we finally have the pieces in place. We have EMRs with lots of data. We finally, with FHIR, have a data standard that actually allows you to compute, right? So we've sort of gone beyond the facts computationally. And then finally, if we harvest it, RESTful and the vast computing power of the internet gives us real-time APIs. So not brokered APIs, not toll-takered APIs, but the ability, as you're using your app, in the same way, if you've traveled over the summer on an airplane, you may have had a delay, and you can just look at your phone and know, oh, they changed the gate again, right? That type of stuff. How about we have that for our blood pressure, our heartbeat, our blood sugar, anything that affects our health, if those are our issues. And the opportunities are vast. I'm quite optimistic. Obviously, there are zigs and zags. The economics, I think, are still to be worked out. But I would encourage this audience to think about, what does that modern world look like? And how are you going to position yourself in a modern way, as opposed to just somehow hoping that nobody moves your cheese?
Yeah. I'm going to connect Eden's point about empowerment. If you were sitting on that airplane, what's amazing is you'll get a notification before any of the actual employees do. When you enable interoperability and data sharing, shows up on your phone before the flight attendant even knows that the flight is delayed. Which just shows you the power of an open architecture like that then makes us feel powerful about, and in this instance, like, we can't underestimate how important this is to each of us, every one of us, right? Healthcare is critical. We're living longer. We want to live happier, healthier lives. We should have more equity and inclusivity. And so focusing on SDOH is great, and sort of thinking really about how we make this $4 trillion investment more effective for all of us, right? Because that's really what this is about. And everyone, ourselves, who we love, look, One Up Health, we're committed. You know, you need agents like us who are going to work on sort of the next generation, benefit from all the technology development that has happened. Like you said about the internet, the data standards, there's a lot of good people working in a direction. We can't come off that. And we're going to be here working on this problem to make sure that the data is available to drive better quality, better value, lower risk, better care, and a better experience for all. Thanks for listening. We'll see you on our next webinar.